Was 47 when I was diagnosed with prostate cancer. In spring of 2010, at age 47, I went in for a routine physical exam, and during the course of that exam, my GP recommended that we do a PSA screen, and I thought something that stuck out to me is he's about my age, and he told me that he was having PSA screens done on himself and recommending that his patients that were in their 40s also start to begin to have that done. And so, of course, we did the PSA screen. My score came back at 3.9 on the initial test. He recommended that we follow up with a second PSA screen, and he referred me to a local urologist. And so I went for that exam. Again, the digital exam did not reveal anything, but the PSA screen, the score that time was 4.4. At that point, I returned to my GP. I wanted to have a consultation with him, and just sitting down and discussing with him what was the probability of having 2 false positives on a PSA screen, which he thought was relatively very low. And I said, well, let's just fast forward this then to what we're probably going to have to address here for myself, which is, the probability that I may have prostate cancer. And I asked him, I said, you put yourself in my place. If you're me, who will be your doctor, and how will you treat it? And without hesitation, he told me that Scott Tulley would be his doctor, and that he would elect to have the radical prostatectomy done with the Vinci robot and the laparoscopic method. Dr. Tulley wanted to repeat the PSA screen. He also repeated the digital exam, which again, there was nothing remarkable. And he told me that if this progressed like it seemed it would, and this was prior to the biopsies, that he felt like I needed to lose about at least 25 pounds before surgery. And he candidly said, it will make my job easier and your recovery much better. I also, during the course of the couple of months that we were going from the initial exam to the time where we had confirmed positive results from the biopsy, I'd done some research. I'd located several people that had prostate cancer and had surgery and other treatment forms. And I knew that from talking with them, the laparoscopic method was going to be much easier on me. And I also learned that the urology center doctors here are some of the most experienced doctors in the world. Through some good dieting and determined exercise, I was able to have the surgery about 6 weeks following the biopsies, and about 8 weeks from the initial visit. As surgery goes, I would say it was not that bad. My hospital stay was a day and a half. The catheter was removed in about 5 days. I was literally back to walking on the 6th day. I was able to return to work within 2 weeks of surgery in a part-time capacity. By the 4th week, I was beginning my heavy exercise program of running again, and the recovery time, I just don't think it was that bad.